So welcome everyone, welcome our panelists. I'm going to introduce them one after the other. Dr. Hannah Neumann. She's a member of European Parliament for the Greens and the European Free Alliance. As a spokeswoman for human rights, security and defense policy, she's head of delegation for relations with the Arab Peninsula and vice chair of the subcommittee on human rights, among many other roles. And she's joining us from Berlin, Germany. And our second panelist is Martina Conte. She has a specialization in European and international politics and the Gulf area. And she's the director of communications for the EGIC, Euro-Gulf Information Center, who's a think tank that aims to build bridges between the people of Europe and the Arabian Gulf, and the co-organizer today, based in Rome, Italy. And then we have Sophia Koller. She's a research fellow for counterterrorism and the prevention of violent extremism at the DGAP, the German Council on Foreign Relations. And she's a project leader of InfoX, an international forum for expert exchange on countering Islamist extremism, and also joining us from Berlin. And then last but not least, we have Jessica Pennetier. She's joining us from Paris, France, in her role as co-founder and secretary general for WISE, Women in International Security France. She's a former army captain in the French army and head of communication, and she was head of communications for the German Marshall Fund of the United States in Paris. So thank you very much, everyone. I've introduced the topic, I've introduced the speaker, and with this, I'd like to hand over to Hannah to give us a short 5-minute presentation. Just one more thing before she introduces herself. We will open, no, actually after all the presentations, we will open the panel to the audience for questions and answers. And please put them in the box with Q&A because the chat gets a bit messy. And if you like, you can direct them to one of the speakers. And I think, yeah, and if there's an accumulation of questions on a certain topic, or if they're similar, they're going to be edited by Arnold, who's from the EGIC. So, and if there's a question that's relevant from someone else that you also like to hear the answer to, you can upvote it. And you can follow our Twitter feed. It's going to be #foreignpolicy_COVID-19. And if you can't stay for the full webinar, it's going to be recorded on YouTube. So you can watch it afterwards, or you can read the report. And yeah, now, Hannah, over to you.
Thank you so much, Susanne. And I'm very happy to be part of this amazing panel. And I might, towards the end of my quick intro, say something about the gender dimension, but I think it's especially valuable that we're here on an all-female panel, because if I look at who's actually currently making the headlines and being pictured as the experts and the ones solving this crisis or war, some even dare to name it, these are all male, while at the same time it's mostly women that are actually holding the pieces together as nurses and working in the supermarkets and so on. And we see a disbalance at the moment that I actually had hoped would be impossible by 2020, but we are going back to some of the very old male-dominated patterns, and it's good that we, at least here, are trying to break those up. I would like to make remarks, maybe given your introduction and the outline of this webinar, on 3 points. The first one is how do we actually work in Parliament now? The second one is regarding the foreign policy and global dimension that I see of this crisis. And the third one would relate to gender and some of these old patterns that I just described that I see resurfacing. We as the European Parliament are especially hard hit by the pandemic and all the lockdown measures, because our parliamentarians live in 27 member states that have 27 different rules. If you are in Germany, even the rules differ within your nation state. We are facing the problem of closed boundaries. So I can't even go to France or Belgium, even if I wanted to. So that's different for national parliaments. National parliaments at least have only their national regulations, and sometimes at least in smaller numbers they could travel. to the national parliaments. This is something that is impossible for us in the European Parliament. And I'm afraid it will be impossible for at least all of us to meet until summer, maybe even longer. And that's especially a hard situation. We are trying to come up with different IT solutions that make at least working committees possible, that make it possible to follow the parliaments or the plenary remotely. We are at the moment fighting very hard to make sure that we can also participate in the plenary remotely. As of now, this is not possible. So while we have to find answers to this very big pandemic that is new to everyone on how to answer it, we also have to find answers to our just institutional quest coming with that pandemic. So it's a twofold struggle, and I think we are grappling better day after day, but I wouldn't say that we resolved the institutional problems and struggles. So this week we're having another plenary. It's Thursday and Friday. We are working on a Corona, so COVID-19 resolution of the Parliament. We are also working to find answers to what the Eurogroup has come up with the protective mechanism, the European stability mechanism, and so on. So we will comment on that one. But we cannot do it in the way we would usually do it, with amendments and plenary debates. And we're struggling with this a bit. So what this also says is that when the pandemic started, it felt as if everybody was falling back on nationalist ideas and on nationalist solutions, and everything was stuck with the nation state. And it took about 2 to 3 weeks for everyone to realize that, well, we are a European Union and we cannot just close borders and we cannot just come up with national solutions, because we have the problems of health workers, we have the problems of those helping with the harvest, we have problems of just the delivery chain, we have problem of masks going from one country to another, we have problem that some countries are very hard hit now, that may not be that hard hit later, others that are a bit delayed, that could actually take in patients. And it took us quite a while to sort this out. And while now I think the call is getting louder and louder on European solidarity, the dimension of global solidarity is totally absent from the debate. And I find this very frustrating, because we are facing a global pandemic that needs a global response. And people on the political level, and I'm really trying to shake this up, and I'm not alone in this, but it's not that we would be super many, shake up this and say we need to look at the bigger picture and we need to think bigger. Because, as I said, it's a global pandemic, and we increasingly see that health also is a global good. So even if we manage to contain or suppress this pandemic somehow within the European Union, as long as we don't stick to having totally closed borders and not letting anyone in or out, and no longer want to rely on global delivery chains, which I think we can't, we need to find a global solution. That deals with and I think we can get into more depth later on, maybe in the webinar, the health situation and the health system, because we have a number of countries that have very weak health systems, not only in Africa, but especially in Africa. We see a number of conflicts that have not stopped because of the coronavirus. Rather, some of them are even getting harsher. We see human rights violations. Of course, it is necessary, and we see that within the European Union, that you need to restrict some freedoms to combat the pandemic. But in a lot of countries, we see answers that are not proportionate to the pandemic. For example, in Turkey, we see that political prisoners are being freed, but not the political ones. In the Philippines, we see a president announcing that whoever leaves the house in quarantine should be shot at. And I can continue this list for very long. So I think there also we need to see very carefully how this is actually increasing the tensions that we had seen before Corona, now in a situation where it's tense on the health system, where it's tense on individual and social level, and we have this added layer of tension of people disproportionately limiting human rights. And we will increasingly see a very big challenge to the global economy, but also to lots of regional and local economies. There's, for example, the situation of migrant workers. First of all, we see what disasters it creates if you try to send them back in a not organized way. We saw pictures in Turkey, we saw pictures in India, where you have these vast amounts of people. But they will not earn money. They will not be able to send remittances home. Some will even be stuck we heard stories of Nepalese workers stuck in India because the border was closed, and also this list can be continued. The same is true for Filipinos or Indonesians stuck in the Gulf countries that cannot go home, that are somehow not supposed to live in their host families anymore, that cannot send home remittances. We have, of course, the global delivery chains. We see that especially now with all the protective gear. But I think there will also be a ripple down effect from the falling oil prices, especially in the Gulf region, but also in other countries whose economies rely on the Gulf prices. And this will just add another layer of tension. I think it's good that what we see now with the International Monetary Fund that announced debt relief, a minor debt relief, at least for the 25 poorest countries, but that cannot be all of it. And I'm also afraid that we will see another battle, the same battle, maybe even stronger, that we now see for the protective gear, like the protective, the masks and the protective, I don't know, Schutzanzüge, whatever the English word is, will start even harder when we actually have vaccines or medicine against corona, because we will never have enough, especially not in the first year. And then the whole battle will start of who will get it first and how will it be distributed. And I think some of the attacks of Trump I find it get it into it. It's a bit of the situation that we had with regards to the Syrian crisis, when we stopped giving food rations or spending enough money on the food rations for those being stuck in Lebanon or Jordan. So the foreign affairs people were always saying, well, this will end up with them coming to Europe. This will end up being a big disaster. This will end up being a major humanitarian crisis. And no one cared until people were actually at the borders. And it's a total different set of crises. So I don't want to compare it in that sense, but I have the feeling that now again we see all that coming, and it's clear that it will have very bad effects on the world as a whole. But it's hard to push through these arguments, and that it would be better to act now than to wait and to now just focus on the nationalist level. I just see that I kind of ran out of time, so maybe I keep the gender dimension for later, or some of the other speakers in the panel, and just hand over to you, Susan.
All right, thank you very much, Hannah. You've mentioned so many topics already. I think we're going to actually keep the questions to after, because I don't want to take away from any of the other panelists and their presentations if I ask you all the questions now. So Martina, if you like, do you want to take over? And I know that you're probably going to pick up on some of the points that Hannah mentioned as well.
Yes, of course. So thank you, Suzanne, and thank you to Musican. Actually, we are very honored to be the co-organizer of this panel, and I would like to welcome also all of you, the speaker and the audience as well. I would like to, the discussion will be about the challenge that the foreign policy debates will face in these days. And is it, of course, this crisis has shown us how we are deeply interconnected. The crisis has been global, but at the same time shows how we are deeply divided. And how deep are the divisions between states, between countries, continents, and also between system of values. And what I would like to underline as a of a think tank is our work has changed, but even in general for the other think tank organization, and why I think it's important, especially in this moment, to keep the debate alive. Because even if it's true that we see nationalized political debates, and of course it's fair that the most part of our newspaper is filled with article about our national improvements, effects, and solutions. It's also important to have a wider view, because the crisis is global, and this is a defining moment for everybody in the world. And the world that we will see after the coronavirus will be different. So I think that
just 1 second, sorry. Sometimes hard to hear you. So maybe if you could actually really keep speaking in it.
like this. Okay, can you hear me now?
Yeah.
Okay.
Thank you.
I wanted to say that for sure we will overcome the crisis, but its effects will last for a long time. So I think that think tanks, organization, politicians have to keep the debate alive and try to give all the information to the people and debate about which kind of world we will see after this pandemic will end. And for example, you cannot talk even in the political debate. You cannot talk about the virus without talking about information and disinformation. That's so-called infodemics. So, for example, the disinformation campaigns from Russia. You cannot talk about the virus without talking about the economic help. And as we've seen, the solidarity has been global. You cannot talk about the virus without talking about the visibility that that we can see about different countries. So in our newspapers, in the news, in the media, we see this kind of mask diplomacy. So we give more visibility to maybe some kind of help and not to others. The role of think tanks in general is, I think it's important also for this point of view. So to give the information and also for a social reason, because it's important to stay in contact with people, listen to the community, fight the isolation. And from our point of view, we keep monitoring the dynamics of the Gulf countries and the relation between Gulf countries and Europe, and examine the short-term and the long-term trends shaping the region. This is the fourth webinar that we have organized. The previous were focused on terrorism, but I think probably Sophia probably will focus a little bit more about this, and the impact of coronavirus on terrorism. We talk about the disinformation, and we give a Gulf perspective on the impact of coronavirus. And I have to admit that it was the previous webinars were very successful, because I think that the audience as well is welcome this kind of new panel, and it's important because give us open more opportunities, because this kind of panel, for example, specifically, of course, we could have done it, but in a different moment and with longer preparation and organizational time. So for sure, for us, it was, we keep working, and sometimes even more. For sure, I will not say that these kind of meetings will replace the human touch, and not only in this sector, but in every sector, even at university, school, and the human touch will never be replaced. But at the same time, I think it's fundamental that we keep to discuss about the world that we'll see after the pandemic.
Very good. Thank you very much, Martina. You also introduced us to the work that EGIC has done before, and you've already prepared the floor for Sophia, who has, I think, yes, exactly what you described. She has to work around how can you keep people connected who need a lot of trust to do their work, and this is going to be harder via the internet, via online. So I'll hand over to Sophia now.
Yeah, thank you very much, and it's a pleasure to be here. Thanks for the invitation. So yeah, I will quickly mention the work that I'm actually doing at DGAP and the impact that the pandemic has on my work specifically. I joined DGAP almost 2 years ago to build up the InfoAct, which stands for International Forum for Expert Exchange on Countering Islamist Extremism. So InfoAct is a short abbreviation to have this large work, but it actually says pretty much what it is. It's a joint project with the Federal Office for Migration and Refugees, the BAMF, and its network partners, who are working on de-radicalization and disengagement of Islamist extremism. So we also call it exit work. The topics that we touch upon, just to give you an idea, are, for example, the reintegration of returnees from Syria and Iraq, the role of psychological factors and mental health in this kind of work, the role of gender as well, evaluating how these programs work, what is success, how can we even analyze what impact preventive efforts might have on individuals, and also topics such as risk assessment tools and the probability of recidivism and de-radicalization efforts also of extremist actors in and outside of prison. As a project leader, I'm responsible of coordinating several parts of this project. The major part and the most important part is we are organizing 3 to 4 international workshops a year with a very specific network of actors. So they are practitioners who are working in advice centers all over Germany on this specific issue of exit work. Then we have researchers who are doing research on these kind of issues. Then we also have policymakers, mostly in state administration level in Germany. And then according to the topic, we also invite international experts to give input on how they are dealing with these kind of challenges in other countries, mostly European countries, because there the experience is most probable to be actually integrated into German efforts. Then the objective of these workshops is to bring together roughly the same kind of actors. So it's a closed door workshop, and to create an atmosphere of trust so that these actors that normally don't work together that much. So for example, let's say security agencies and then practitioners who are, for example, social workers, they come together and they have the opportunity in a trustful setting to exchange on challenges in their work, but also on good practices. So how does cooperation work? How can we deal with a specific case that is very challenging apart from formal structure? So it's more of an informal setting. And these discussions are then also processed in issue papers. So we publish publications on these issues in English and in German. You can find them also on the DGAP website. What we started this year is an additional aspect. So we started to implement a newsletter who is communicating journal articles that we consider high quality, because there's a lack of good science in this kind of field, a lack of really scientific proof of what works and what doesn't. So it's very important to draw attention to good science in that regard. So these issue papers and a newsletter, let's say, I can do it from my desktop research. I don't have to interact with people that much. I can write it on my laptop. So in this sense, the pandemic didn't have a lot of influence. Whereas in March, we had everything set up for our workshop, focusing on risk assessment tools and dealing with highly radicalized individuals. We had great set of experts, and then 1 week before, we agreed with our partners to not do the workshop, but within 1 week to change it into an online webinar on Zoom, the platform that is still a question if due to data protection services, it's still the best option for now. And we had to very quickly think, how can we even do such a workshop in an online setting? And truth is that is within within 1 week, you can do a lot of things, but you cannot just, turn such a format around. So we did manage to bring in the international input. We managed to have participants ask questions, so that went very well. But what we do now is that for the next workshop in May, we are currently thinking, how can we actually, organize a workshop that has networking in it, that has small working groups in it, that has informal exchange in it. So all the different parts that make our workshops so successful, so participants actually, open up and they to connect to each other and so on. Where are the coffee breaks? These are the questions that we are facing right now. And I think that what the pandemic brought is certainly a lot of challenges, lack of international cooperation, lack of face-to-face meetings. But on the other side, I think it opened up also many opportunities to try out new innovative tools, to see before really calling it off and not doing a workshop like that. How can we make the most out of the tools and the opportunities and everything that we have? And make it work somehow. And we have also seen that our participants are very grateful that that we do the workshop and that we don't just say, no, we can postpone it in half a year, because the work that they are doing it still needs to be done. And they are also much more forgiving if there are technical difficulties and so on. So I think it's a great time to try out some new things. Then to touch very quickly upon some impact of the pandemic on violent extremism and also terrorism in some sense, is that of course we see that people that are let's say in more difficult living situations are much more harder hit by the pandemic. So we see an increase in inequalities, for example, both social and economic. We see that marginalization will be pushed further. We see that also everything that is the human contact that you need when you do exit work. So really go and engage with the clients that are in the programs that you're doing. It's much more difficult. Research is more difficult to make. Going into schools and talking to people about the radicalization drivers and so on is much more difficult. And on the other side, on terrorism issues, is that there's less staff. So there's less staff in security agencies for police officers. So it's not only practitioners, of course, but also from the security perspective, it's going to be more difficult to uphold that kind of scrutiny and that kind of attention also on these issues, where a lot of agencies are struggling to actually do their normal day-to-day paperwork because they're not prepared for that kind of digital work. So that also has an impact on preventive policies, on having an eye on different groups, how they behave, on different actors, both individuals and groups, and how they exploit vulnerabilities much more than during normal times. And lastly, also the issues of, once they plan an attack, what are the targets? Because targets such as restaurants or cinemas or concert and so on, they're all off. They're not longer happening. So what are the new targets? Are we talking about hospitals, for example? There was a very interesting article recently from another think tank that spoke about the possible attacks on the infrastructure that is very crucial right now. So let's say hospitals or people that are caring for the sick, and then have a very high psychological effect of fear of even this kind of infrastructure that might be targeted. Yes, so I'm looking forward to the debate and the questions.
Thank you very much, Sophia. Yeah, again, you touched on lots of different topics. We had terrorism, we have the work one-on-one from practitioners to people who are who actually need to be maybe not closely monitored, but who need to be in direct contact. And I don't mean the social workers with each other or the practitioners with each other, but also the people who returned, the foreign fighters who returned maybe from Syria. And so that's going to be a lot harder now to do this kind of work. But I'm going to move on to Jessica now. And Jessica, maybe you can tell us a bit first about your experience in the army, because I was absolutely stunned that you were a captain in the army. And then, yeah, thank you.
Well, first of all, thank you very much for inviting me to this webinar. It's a great pleasure, and thank you to the Eurogulf Information Center too. So yeah, I spent actually 5 years in the army, and that was a very fascinating experience. I learned a lot. And it was also obviously a very traditional male dominated field, and that's where I kind of think I developed my interest for gender issues. And I am now Secretary General in International Security, which I'm sure you've all heard about. Women in the US in the 1980s, and then lots of different chapters were set up around the world. And WISE France was launched 2 years ago now at the French National Assembly. And our aim is really to promote the expertise of women in the field of security and defense, but also in foreign policy and other areas. So I will, I think, very briefly touch upon what Dr. Hannah Newman said in her introduction, and it was very interesting. But just very briefly, so WISE France has based its action on 3 pillars. The first pillar being policy. We conduct research on gender issues, and we look at facts and figures on where women stand in France in the private and public sector. We have a huge pillar which is dedicated to HR. We try and help women meet other women already working in the field of security. We try and pair students with maybe high level officers or non-commissioned officers in the army, for example, or in the private sector, so that they can get hold of concrete tips to advance their own careers. We organize mentoring sessions, networking sessions. We also organize other events such as speed expertise events to showcase the knowledge of these women in the field, because having worked myself in a think tank in the German Marshall Fund, working on defense, foreign policy issues, I got to realize that actually, although there were quite a lot of women studying these fields, it was quite interesting to not actually see that many women on panels talking about those issues. So the aim of WISE France is to have that bottom-up approach where we stimulate change, encourage a broader discussion about the importance of gender when examining security challenges. And we really do believe that a more diverse staff within think tanks, within the public sector, within the private sector will stimulate better approaches, because we all know that women bring in a different approach to foreign policy issues, and that has already been demonstrated by far. And a lot of progress has been made, but what we're seeing, and we've seen it with the COVID-19 crisis, and that's exactly what Dr. Hannah Newman said in her introduction, is that we, in an emergency response communication plan, we've only seen men being at the forefront of this whole work of strategizing and conceptualizing the policies which will be implemented in the post-COVID-19 era. And that is quite frightening, because it means that in crisis times, we fall back into traditional ways of thinking, and the gender factor is suddenly totally erased. And I mean, there was this photo in the French media recently about Macron's scientific council. And I think you all saw it, but I mean, we only had a group of men around the table. And that actually did strike me, because gender equality is part of his top key mandate priorities. So you would think, well, what about all those women out there who are working around the clock in hospitals? Because, I mean, in France, we have, I think, 80% of nurses are women, which is a huge amount. So I think Wise France actually decided when the crisis happened to really put those women at the forefront of its spotlight. So we try and communicate on women scientists, researchers, PhDs who work in those fields, and we also try and organize events which were supposed to be physical, but we're now doing webinars on professional development skills to also help women out there use that time to gain more confidence. And also we're going to launch very shortly a hotline to help students who can't go to school or university to actually match them with other women so that they can call them and get more tips on their experiences and advice on careers in security and defense. So yeah, that's what we try and do at our own level, which is a civil society level, and I think it's this gender issue is crucial because there's going to be a huge amount of work being done at the EU level and international community level, and I think it's really important to ensure that women are part of these discussions, that they have their say in the policies which will be voted and then implemented. I mean, because we represent half of the world population, so if we're not part of this, then it's going to be very problematic. That's it.
All right, thank you very much, everyone. I think we've heard from so many diverse areas already, and I just have a look. We have 63 participants, and 2 have posed questions already. So maybe we'll just jump right in, unless one of you wants to add anything to the presentation so far. Okay, so the first question is, greetings to the panel, and what is the opinion of the experts? It's a general question to all. There's a big lack of incoherence between the EU member states regarding cooperation in COVID-19, so that we have the same measures in all countries to be consistent in Europe, since there is this free movement of people in theory. That's a very valid question. Hannah smiling already. Maybe you'd like to answer it first.
On in the Parliament this week. As I said in my introductory statement, in the initial response, every nation state were basically falling back on the nation state as the level on which they are. Now, they're seeing increasing the problem that come with it, and also the European Commission is trying to get a foot into the response. However, I think we will have to see, just in the way the pandemic works, we will have to see incoherence between regions. But from a pandemic point of view, and that is where we are working to also on the political level, is it makes sense to be more restrictive in areas where we have a main outbreak, and to be less restrictive, for example, in areas where there is not so bit of an outbreak. And these areas will shift, but they will shift regionally, and it doesn't make sense that they shift across national borders and with nation states. And that is the kind of way how we are trying to break up this focus on nation states. But the EU can only do this to the extent that member states allow it to do it. And that is the biggest problem that we see at the moment, that actually the EU level is the level of response that we need, but member states do not want to give up the sovereignty and let the European level do it, but they rather want to have their own national solutions for whatever reason they still see as a problem that they can handle better at the national level. And I think we have seen it yesterday with France, with President Macron announcing that the lockdown will continue basically unchanged until May 11 with very restrictive measures, where at the same time Austria is trying to loosen it. And I think we will also see some more loosening in Germany in the next weeks. And so it would make sense, as I said, to loosen it regionally depending on the outbreak, but it doesn't make sense to do it on the national level. And here we are currently working, and the Commission is working on an exit plan, a European one. But as I said, it depends to a large extent to how far the member states give up the sovereignty and to the European level, to what extent we may be able to see an answer on European level. But what we see at the moment with the national borders, and that's the incoherence the person that asked the question pointed to, and the free movement in theory, well, we have this problem. Even if I look at Germany, and that's, I mean, what I know best, with the Polish border, it's basically closed. So even health workers from Poland who need to work in the hospital in Germany, they have to stay. And when they go back to Poland, they have to go 2 weeks to quarantine. So now they're working 4-week shifts going back and forth to Polish. Then in Belgium, with regards to Belgium, there's 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 full freedom of movement basically between Belgium and Germany. And this is kind of the incoherence we have, and that is very hard also because if you travel, even for me, if I would travel to the European Parliament in May, which I plan to do, and I would stay there for the full 2 weeks, so not to have too much movement, I don't know whether they might change the regulation while I'm in Belgium, and then when I have to go back, I will have to face a different regulation from when I went there. And that is very much hampering this whole European idea and spirit. And that's why I hope we will be able at some point to move towards a more European and contextualized response.
Thank you very much, Hannah. Would anyone of you like to add? Martina? Okay.
Well, I'm trying without headphone. Can you hear me well now? Okay. I just would like to add something. So the impact that on foreign affairs that this fragmentation of the European response, which also is very important, and we have to keep monitoring. In Italy, the effect is that there has been a collapse of the support to Europe. The last survey is a national survey of last week. The data are that the support of Italy to the EU now is of the 27%. It was 42 in November last year, and in this the reaction is it very low, and this is also reflected in every European institution, so Commission, Central European Bank, etc. So it's important as well for us to promote the pan-European debate, and at the same time, it's also important to work also on the perception of what Europe actually do, because well, I'm the communication manager, so I always look at the also how the data and the information are reported in the media, and what we see is also that Italy itself, but even other countries, there has been a kind of solidarity. So, for example, we've received 1 million masks from Austria, and help from Germany, from France, from Czech Republic, even 10,000 of protective suits. And in the news, you don't see that. You can read only about the big help from China and Russia. And this is important because if Europe is no longer a safer place, then countries like Italy could shift their attention to other international players. So yes, it's important also to keep this the track of this trend that seems national, but actually that will affect the global order itself.
Thank you very much, Martina. It seems you've already answered one of the questions by Lisa Maria Fiocca. When our country, Italy and EU countries, will come out of this dark period, how the foreign trade among our countries and USA, China, etc. will change. China will always be stronger and stronger. So you already gave the answer, right? So the next question we have is by Szabolcs Kovac, and he asked the very first question, or she asked the very first question as well, and it goes to Sophia. Your opinion on the potential impact of the coronavirus crisis, what it might be on the MENA region, and especially on US-Iran relations, conflicts in Syria and Libya, Yemen, Somalia, the stability of Arab countries, the oil market, the empowerment or weakening of terrorist organizations. So I guess you have time until 12:45.
Yeah, that's many very complex questions in one. So that's sneaky. I'm not going to comment on US and Iran relations because it's not the focus of my work, since I'm focusing on extremism and terrorism in Europe. What I do see looking at the conflict dynamics, because of course these dynamics have an important impact on Europe as well, specifically the conflicts in Syria and Iraq. So we do see that the US is, for example, withdrawing troops. So of course, whenever a country, or let's say many countries across the world are faced with such a health crisis, a pandemic, I think somebody extend, you go towards your own national interests, you go towards your own crisis management, and anything else that is on the agenda is much less urgent, and that also holds true also for international corporations. So it's less of an urgency, is what would be my opinion. And in addition, the governments of, for example, also in Syria and Iraq, often in peace times are not able to provide the kind of health services to their population that would be needed. So in this kind of crisis, if even very developed countries such as Germany or France or the UK are struggling with this kind of crisis, it will be much more difficult for any other government to actually provide the kind of services, the test capacities, the protective gear, the kind of equipment you need in a hospital to actually be treating these individuals, and also because the international markets do not have the capacity to even let them buy, even if they had the money and they had the logistics. So all the questions that we are facing here in Europe times 10, and you can look at the situation in other countries that are much less stable. So what we do see is that a tendency that terrorist groups and organizations are exploiting also the weakness of the state, and they are increasingly providing services to the populations that are in these regions. We have seen this before, where, for example, in the former territory of the Islamic State, that was kind of impressive, you know, the kind of taxing system, the kind of healthcare, the kind of schooling, not according to our values, but according to their values. The system was relatively impressive. And I think for health services, that this might also be the case, that in unstable areas, terrorist organizations can have an advantage and create links and gain trust with the population if they provide these kind of services. If they can do it in times of Corona, I'm not sure, because this is a completely different aspect than providing normal health services. But I think it could be an opportunity for them. And last also is that the whole pandemic is also linked to the general tendency of disinformation, spreading, of propaganda. What are the facts? Where did it come from? I mean, there are also a lot of opportunity to exploit this kind of communication by terrorist organizations, because what we have seen is that any kind of technological innovations, terrorist organizations and extremist groups are very able to exploit. So in times of crisis, what we see is that they tend to also be very innovative. So I think that this is something where we would, should watch also very closely how they might exploit this kind of disinformation and exploit them for their own purposes. Last point maybe is that also in the African context, for example, we see that many efforts towards you know, bringing groups and actors together, make stakeholder meetings, make people meet. So the kind of work that I'm also trying to do on a different level. How can these efforts be upheld if personnel, for example, from the United Nations is flown out of the country, they cannot access anymore, many operations are put on hold, personnel is not able to access areas anymore, and this is for a longer time. So there are efforts to uphold this kind of you know, peace initiative, conflict resolution, and so on. But that's not, as I said, it's not on the agenda very high, because now it's about health and life and death. So these questions just like they become less of a pressing issue at the moment for the international community, which will have long-lasting consequences on security. That I'm very sure.
Thank you very much, Sophia. Jessica, maybe you'd like to add a little bit on that, because you know how, for example, women contribute to the, or you know, you can talk to us about the Women, Peace and Security agenda and the contribution of female peacekeepers. So we've heard from Sophia, it's going to be really, really hard. Is it going to be even harder for women now? Women peacekeepers? And then I would go back to the question and answers, because I see Mitchell is already on it.
Yes, indeed. I mean, we've done a bit of research here on the Women Peace agenda, which we're following very closely. And as you know, this agenda was voted in 2000, so we're approaching the 20th anniversary in October. And we've gone a long way since 2000, and a lot of, I think a few resolutions have been voted since then, and there's been a conscious effort that was made by the international community to increase the number of female peacekeepers in operations. And because we've seen, and again, research proves it, that women who participate in peace negotiations, well, the peace agreements that then follow have a higher chance of lasting than the peace agreements who were negotiated without women around the table. So that is something that has been shown, and we're trying to increase the number of women out there, but it's still difficult, because most of the countries contributing troops to peacekeeping operations are countries which have not really factored in the gender issue into their policies. So it's something which is we're getting better, but again, it's a matter of national sovereignty, because even though many states have signed the Women, Peace and Security agenda and have signed the resolution, then it's up to them to decide how many women they want to deploy within those missions. And for example, France peacekeeping operations, which is a really small amount, and we have only 6.5 women in our overall operations deployed on theaters. So the numbers, I mean, still speak for themselves. There has been a few advances, but it really remains up to and will be sent out. So it's a hard one, but we're hoping that, you know, by also as a network of women working on those figures, to show that there needs to be more done on a national level.
Right, thank you very much, Jessica. We're jumping back from the national to the international, to Mitchell Bertha's question, and it looks very tame, but I think it's very tricky. So many thanks to this amazing panel. Quick question to everyone. Are you optimistic or pessimistic in relation to the lessons learned from COVID-19's impact on foreign relations? Are we learning as an international community? Who would like to go first? I'm just gonna, yeah, Hannah, you're leaning forward.
Well, I can try to go first. I would say it's hard at this moment to make an assessment of the lessons learned because I think we're just starting to learn. So that's the first of it. I think we're starting to learn, and it depends much on how big that learning curve is and with how much success it may come. But maybe more to the question of what could the optimists see and what would the pessimists see, and maybe we can take it from there. As an optimist, I think we will increasingly see, and we haven't even started learning on that one, that this is a global pandemic, and that brings more to the forefront again how connected this world is and how global response needs to be, and how much we see it now in terms of health, but I think this will go to other sectors, how much health is a public and a global good and not a private and an individual or national one, if it has to work. And I think we will see the same for economy. We might hopefully see the same for some of the human rights. And if we see this, and if we learn this during this pandemic, then I think it will lead to a big strengthening of multilateral organization and global responses and more global solidarity. So that's what the optimist sees. What the pessimist sees is that many, especially of the big powers or the formerly big powers, are at the moment so much concerned with their national situation that we fall back on all these kind of ancient, or we hope to be ancient, patterns of nation state, of the male dominance and the authoritarian ruler's answer. And if we cannot get over this but continue to stick in this pattern, then that is the pessimistic outlook. Much of the global organizations will be weakened, and the most vulnerable will just be hit hardest, and the notion of solidarity is going to get lost. And I think all of us should fight for the optimistic version so that we get as close to it as possible. That would be my answer.
Thank you very much, Hannah. Would any of you like to add anything?
I would like
Jessica?
to add, yes, something. I think that as Dr. Hannah Newman just said, given the temptation that this crisis brought for countries to look inwards and really just focus on national issues, and also given the temptation to withdraw, when I'm thinking of all those European countries, it's actually quite interesting to see that, in fact, the EU has been capable of joining forces, and we've seen actions of solidarity, as we mentioned, with Italy and German hospitals welcoming patients from France. And I think we need to really focus on those actions, and I think the EU has a central role to of this crisis of the multilateral order, because let's be honest, I mean, this pandemic is stretching the international order to a real breaking point, and it has a huge role to play. It's a window of opportunity for it to actually show that it's capable of taking in such a shock, and also prove that it's there to defend the multilateral order. And President Macron said it in its speech last night. I mean, it's a real matter of solidarity. I mean, we're in this together. It's a pandemic which is spreading at such an incredible pace, and everyone is being taken by surprise. So maybe now is the time for the EU to protect its citizens without looking inwards, and really using this opportunity to rethink maybe its model, and to show that it is all about solidarity. So I really see that as being a window of opportunity for the EU, especially. But maybe I'm being too optimistic here.
Well, I always like optimism, so I'm optimistic that Sophia or Martina would like to give their answer as well? No, and nothing to add. Okay, Martina.
Well, actually, I agree with and to what has been said, but from the pessimistic point of view, sometimes I'm more pessimistic. So we see that it seems that the best actor, the one who will be able to fight the pandemic within the border, will win, even outside the border. And the bad thing is that it's not a game. It's even here it would be good to see more cooperation and solidarity. So that's all.
Okay, thank you, Martina. That's tough to swallow. The best one will win. But we have a lot more questions, and we'll see whether we can answer them all. We have another 25 minutes, so we'll see. M. Rahman is asking, regarding international cooperation and perception in Europe about COVID-19 response. Many people are criticizing the European Union for failing to act decisively quickly enough to this pandemic. This criticism can be seen by countries unilaterally shutting down borders, restricting, banning exports of medical equipment, etc. What we've discussed. What would you say be the EU's response should have been like, and whether it should do and allow more international cooperation? Would anyone like to answer? No? Is it too speculative yet? Okay, Hannah?
I mean, what I think with we had a similar question already, and what I outlined there, what I would want to see now, like with a joint European Union approach that also goes for recovery or corona bonds or name it whatever you want to, but where we share the economic burden of the crisis, where we share equipment and where we share knowledge as good as possible, irrelevant of what nation we are talking about, and where we find answers where we find answers to regionally specific outbreak problems rather than nationalist ones. That is what I would have wanted to see from the beginning, and what I want to see now, and how I think the answer should have been. But again, the problem is the EU needs to be empowered by member states to do this. And as long as this doesn't happen, it's not the fault of the EU. And I think we have to be very precise on that one.
All right, thank you very much. I think you made it really clear. We'll go to the next question now. So we have good observation on EU support to Italy, Ms. Conte. What's the reason that China's tiny actions get visibility but others not? Maybe one of the reasons could be money flowing to journalists and advertisements in newspapers. Would love to have your comments, and that's by Anup Sharma. So, Martina. Martina, you need to switch on your microphone, please.
Right. No, actually, no. I think that is in this time of crisis, as China had was the first who has been hit by the pandemic, received also more visibility, and so that's. Well, someone claimed that there is this so-called mask diplomacy, so that some countries are using help to gain more power and visibility. The truth is, Beijing has moved quickly before other states, taking advantage of the opening and a vacuum created by other countries, for example, the United States, but the beginning. And at the same time, I think that the assistance that it's more visible it can be also a way to cover a little bit the problem that China itself had at the beginning, because it seems that they try to cover a little bit the beginning of the pandemic and maybe had a late intervention. So probably it's because of also because of this.
Right, thank you very much. And the next question is by Palaviade. My question is to all the panelists. In this lockdown, the focus has been on health and staying indoors. However, this lockdown has raised concern over increase in domestic violence, as well as the rights of minorities and differently abled. Governments across the world have still focused on the health aspect of the crisis. When will we see a shift towards focus on the collateral issues arising out of the pandemics? Again, that's a tough one, Sophia, yes.
Yeah, just some thoughts, because I see some parallels to my field of research. So what I see is that there are always the active measures that can be in place more quickly, that are more easy to implement, and then there are the longer consequences, but also the general situation of, for example, domestic abuse or sexual abuse or minorities, or, for example, talking about refugee and migration in camps in Europe, but also in other countries around the world. So these are topics that that need to be addressed very quickly and for decades. And there is still not enough attention now with the pandemic. The headlines on refugees stranded on the border to Greece have received much less attention, but the situation has not changed. On the contrary, it's exacerbating all the different dynamics of health that have been there already. Because how can you tell people to social distance and to wash hands with soap if they have not running water? This holds true for refugee camps on Europe's border, but also to camps in Idlib. So these are questions that we will have a very hard time to hear the news coming out of these camps in the coming weeks and months. And this is only a question of time until these kind of health crises exacerbate, because we have seen that several health crises of sicknesses coming out of these kind of situations. That's only normal. It's predictable. So what I would say is that similar to counterterrorism efforts, the harder measures that have been implemented in the last decades were shown not to show a lot of consequences. So you have to address the underlying issues of inequality, of vulnerability. How can you prevent people to even become attracted to kind of ideology? But these need addressing with long-term consequences, and there is not a political agenda that will address these issues on the top of the agenda all the time. It needs a terrorist attack so that we say, oh yeah, there is this question, so we have to do prevention, and then you put some money in it, and then once this memory of terrorist attacks fades, it's not sexy anymore, but the problems are still there. And without being a health specialist or so on, I see this parallel of addressing underlying issues, addressing of long-term consequences, and I'm not surprised at all. I would be happy if these kind of issues would be addressed, but for now, as I said, it's not on the top of the agenda. But we will feel the consequences sooner or later, and this is what I study. It's about radicalization also. Certain actors exploiting this kind of negligence of governments all around the world.
Thank you very much, Sophia. Yeah, I think I'll just go on to the next question, which is probably direct. Yeah.
Add something. I just wanted to add that with regards to domestic violence, I'll only be speaking for France, because that's what I've seen so far, is that maybe also it's true, this is a real issue right now, and maybe the government was a bit slow in reacting to this problem, but I've seen in the streets at the supermarket now, even when you buy food, you have your printed receipt with a number that you can dial if you've been a witness of domestic abuse, or for people who are suffering this kind of abuse. So there has been concrete actions which have been measures taken by the French government to remedy this problem, and it's true that I don't think that when the lockdown was imposed upon people, it actually was it was something that people had really thought about. But you can see that I mean, in France, that there's a lot going on to counter that kind of domestic abuse.
Thank you, Jessica. Yeah, maybe I can give a little bit of input on this as well, because I sometimes work and help out at a women's shelter here in Berlin. And what I've seen is we all noticed and we all heard that in China, sexual abuse has risen, and divorce as well afterwards. So we knew what was coming, and we heard it from Italy as well. We're hearing it from France, we're hearing it from Germany, and there have been these initiatives to print COVID-19. If you say mask 19 in Germany in a pharmacy, then they know that you might be a victim of sexual abuse, which is good. But and I know the Senate has opened up a hotel to help women who can't stay at home and their children, and they're trying all these measures. But the actual problem is there have been way too little places in Germany, in Berlin, in women's shelters anyway, and there are way too little social workers who can take care of it. And actually the social workers that are there, they are women. Some of them might be too old, some of them have little children. So we have all the problems that we have in the general society doubled. So even if we have the places, we might not have the workers who can actually assist the women who need help in that moment. So maybe that's something to be put on the agenda as well, that we don't just, well, of course we need nurses and we need doctors and we need everyone else who's really relevant and helping and taking care, but we also need the social workers to take care of the women who actually make it out of their homes. But that's on the side now, and I'm going back to the questions now. So thank you to the panelists. In your opinion, it is just a coincidence that it seems the countries that have handled the pandemic well, for example, Germany, New Zealand, Finland, Taiwan, Iceland, are led by women? It's a very nice question. Is it a coincidence? Anyone wants to answer that? Hannah?
Well, I can try to give it an answer. I have seen that, I think it was a meme over the Easter holidays where you had these 6-7 women, and well, I mean, first of all, I think there are some qualities that one needs in response to this crisis. One is empathy. I mean, we just discussed about the issue of domestic violence, but we also have to discuss about the situation of people who just don't know how they would make ends meet 2 or 3 weeks from now. Even the situation having small kids, or also teenage kids, by the way, being in a 60 square meter flat for 4 weeks with their parents. I mean, that is just, well, so it's a lot where people follow the rules if they see that still the challenges they have by following the rules are taken into account, and then there's an empathic person that knows what it means for all of them, that what they have to go through. And empathy usually, I mean, is a quality criterion that female leadership, not every woman is, but it's something that is generally attributed to female leadership. The second one is, I think, being very humble in terms of knowing what you know and what you don't know, and listening to science, and not just one science, but the different perspectives of the different sciences. Which is what I think also helps in this crisis, and what is also a part of what is usually attributed to female leadership. And that's why I think that some of the countries with female leaders are doing very well, because they combine these two aspects, or 3 aspects. On the other hand, one has to be honest and also say we're not done with this crisis. So we will also have to see in these countries how it continues. And there are other countries, like, for example, South Korea, that have done tremendously well for other reasons that don't have female leadership. So as much as from a feminist point of view, I like this meme, the world is more complex than this meme.
Yes, thank you very much. And on to Martina, please.
Yeah, no, I would like to add something. Also, I was expecting this question, but no, yes, I'm sure that for other countries there are other factors that contributed to the good management of the pandemic, but I don't think it's just being a woman that contributed to the better handling the global pandemic, but also it's because I think in the political level, but not only in every sector, sometimes for women have a different kind of request in time of standards. So sometimes it happened that a woman in a top position is required to be more, have more competencies and skill on average. So probably these leaders were very good in managing in the crisis management even before the pandemic. So it's something connected to the selection of the leadership in the political world, but even in the private sector.
Thank you very much, Martina. And I think your boss wants to ask more questions. So here's Mitchell's questions. One for Jessica. There's a European and indeed international discourse that calls the struggle on COVID-19 a war. To what extent is this war language used to mobilize masculine solutions, or do you think it is actually a war? And we'll do the second question, which goes to Hannah afterwards, okay? So if you'd like to answer.
Sure. Yeah, I think the rhetoric used by our president has been very clear from the start that this, as you said, was a war, and we saw him create a council, a specific war council. Like he gathered around him all these experts and scientists, and we did feel like all of a sudden it was us against this pandemic, and but I think the communications around it wasn't so good insofar as we totally erased the gender factor in there, and as I said in my introduction, we did not see that many women involved, and I think this is where we need to be very careful again, because as we're developing strategies to fight this pandemic, it's very important to showcase the expertise of those women who are working in the field. And so it suddenly felt, and as I was reading the media articles about it, that strategizing, conceptualizing policy is a male reserved task. And I mean, that is wrong. That's not the case. And there are prominent women in foreign policy and very high positions. And I just, I was a bit shocked by the way this was mediatized. And then we saw on the front page cover a few days ago of French media that we had the interview of 4 men on what's going to happen next. And I saw a lot of people reacting to that cover saying, but why are you interviewing 4 men when there are also women who could give their opinion on what's going to happen next? You know, so again, we're in a crisis, and we're falling back into old ways of thinking, and that's what we need to fight. We need to fight this pandemic, but we need to fight stereotypes as well, especially now, because everyone is turning to the media to get answers. So it's crucial that we make sure that those answers are diverse and inclusive.
Thank you very much, Jessica. I like how you implemented war language in this as well, fighting gender stereotypes. Mitch's second question goes to Hannah. Perhaps you could talk a little about the Green Party's early assessment of the environmental impact of COVID-19. For better or worse, the global economic slowdown is a good break from environmental degradation.
Yes, there's again a better and a worse, and we have to see which one wins in the end. We have seen in the initial weeks, and that caused some optimism on our side. We have seen like dolphins in Venice, which was impossible. We have seen how actually we can still continue to work without flying around the globe all the time. We have been seeing how big a response in what short time could be to something that is actually perceived as a crisis. And even I'm sure all of you saw this flatten the curve graph, when in the end every one of us, even like those that are not health scientists, understood what it's all about. But I mean, there's another curve that we need to flatten, and that's the one of climate warming. And that's a bit the pessimistic side, that first of all, it's hard to grapple for those who are involved in this climate business for a longer time, why it's not seen as a crisis of equal urgency for us living on this planet, and why everything that has been said to be impossible to change, to do, to spend, because of the climate, has now been possible within 4 weeks because of COVID-19. That doesn't say we shouldn't have done it for COVID, but it says, well, but then let's try to do it again. And at the same time, we now see many of the things that we have fought for so hard, be it a new environmental law when it comes to the pesticides to use for agriculture, and be it about shifting the automotive industry towards more renewable engines, is kind of now already like silently taken back. Like, now we have to fight COVID, let's not add another burden to the industry. Now we have to fight COVID, let's not add another burden to the farmers. And we are trying very hard to say, well, we now have the chance with all these subsidies coming, with all these recovery plans coming, to align them with the Green Deal and with this idea of building a more sustainable, ecological, social economy. Whereas on the other side, people are saying, well, let's rebuild the economy and then see how we can do this maybe later on, and everything kind of being postponed. And these are the two narratives that are at the moment battling with each other. And I'm not sure whether this COVID-19 crisis is making it easier for us.
Right, thank you very much. I have to have a look at the time, and we're nearing the end of our panel, unfortunately, because I think we only had the chance to touch on very few topics and not in as much detail as we could have and as we would have liked. I have one more question that I don't want you to answer, but maybe it's something that could be saved for another panel. For example, what will be the influence of the pandemic on the immigration policy of the EU? And that's just a short one. We can't answer that now, unfortunately. I'm sorry. So I would like to give you all 1 minute statement at the most. If you could just bring your point across that you really, really want to ram down now, this is your chance. Sophia, would you like to start?
Yeah, I was wondering if I should also contribute to the question about the language of war and so on. And again, I'm drawing the parallel between talking about terrorism and talking about this kind of crisis. And it's striking how you see the dialectic narrative between us versus them. The other side is a sickness that needs to be addressed. And also this kind of state of emergency, for example, that they declared in France. It's based on the same law that was used after the attacks in Paris and some they need. So it's based on the same kind of understanding that in terms of big crisis, you are allowed to take emergency measures. You're allowed to use the power that you have to frame the crisis, to use specific kind of narratives, and to get out other kind of narratives. So you said that like it's very masculine, the discourse and so on. So in these kind of crises, it's more forgiven if the language is framed by the masculine leader, for example. In other languages, well, yes, we can get to diversity but a bit later. And what I want to bring across, what I think is very, very important to watch, emergency kind of laws, policies and responses and so on, and becoming slowly the normality. So dealing with a crisis in terms of crisis can be allowed, but it has always the imperative to be only during a short period of time, and all the political processes of oversight, of parliamentary debate, of social debate and so on, they need to be there. They cannot be paused. And same as the war on terror and counterterrorism measures and so on, this cannot be permanent because this is not the answer. And I do hope that from what we see in the counterterrorism field and the prevention of terrorism field, that this kind of permanency is not what we need to really effectively address these kind of crises. It needs to be more sustainable and more inclusive in addressing. Thanks for having me.
Very good. Thank you, Sophia. Okay, Jessica, 1 minute at the most. We have 12:45 now.
1 minute. Well, I think I will be very optimistic here and say that this pandemic, like it did, I mean, I'll go back to the First World War and Second World War. Women played a very, I think it's really an opportunity to show that women are there. Women are working around the clock. They're also contributing to this war effort, if I use Macron's rhetoric. And they have a lot to bring in shaping the after COVID-19 era, because a lot will change. The world will not go back to what it used to be. So this is really a time where we also have to be in the spotlight, and because future policies will need to bring in our perspective.
Very good. Thank you, Jessica. I just didn't want you to go back to the First World War and the Second.
No. I was just thinking of how women played such an important role during those two conflicts. Yeah. Well, it's again, and maybe it's an opportunity for us to show again that we can handle this kind of crisis.
Thank you. All right, Hannah, can you show us how to handle this crisis, please? Very quickly, very shortly, and then Martina will have the last word.
I'll do it in 1 minute, and then I'll be the rule of the world. No, but what I think is important is that it's a global crisis, and we need a global response. It's the crisis that targets the most vulnerable. So the response needs to be inclusive, which it is not at the moment. And I really think speaking in words of war and treating it like a war is the absolutely wrong way of going, because what we need now is solidarity, is being kind to each other, being very humble and being very responsive and looking after each other, after the others, after our society, after our neighbors, after the most vulnerable. And all this is not what people usually think is qualities in the war. So I really think we should be very careful in our response, but also in our language.
Perfect. Thank you very much. Martina, the last words for you, and then I'll wrap it up in 30 seconds, I promise.
Okay, now I will just add a call. As we already said that, of course, the impact of the pandemic on gender has been huge for many reasons, and I would like just to underline that women organizations are vulnerable now, not only in Europe but even in developing countries. So the routes to safety and support will be shut down and will receive less attention. And the call is that even if, for example, in Italy, but as we've seen even in France, the task force to fight and coronavirus are composed for the most part of men. Okay, so the perspective, women are not really super included in the decision-making process, but at least still involve the association organization to the discussion to solve the problem for the short term and even for the long term.
All right. Thank you very much, Martina. Thank you much. Thank you very much, everyone. I think the biggest takeaway we have today is that we can't just look at ourselves and we can't just look at the nation state, but we need to think globally and diverse and have equal balance for everyone, and not forget the ones who are in areas of crisis or who are just less fortunate. And that includes refugees, women and children, this. And just the very last few organizational things I want to say is you can watch this debate on YouTube in a few days, I think. You'll get a written report. Everyone who still has open questions, I'll make sure that the panelists get them, and we'll try to give you an answer as well. Maybe we can just write it in the Q&A afterwards. And I need to thank Mitchell Belfer. I need to thank Nicola Zukalova. I need to thank Martina Conte. I need to thank Arnold Koka and Jan Saint-Pierre, because they all made this possible and they all worked in the background. And I especially need to thank all our panelists, Hannah, Sophia, Jessica, Martina. You've been absolutely amazing in the preparation, but also during the panel today. Thank you very much, everyone, for staying with us, and hope to see you soon on another topic, maybe.
Thank you.
Bye.